Welcome to the Living Life Well show, the intersection of God's Word, today's science, and healthy living with common sense application, all based on the truth of the Word of God. I'm your host, Dr. Jon Skelton. Now let's get straight to the truth. Well, welcome back to the Living Life Well show. I'm really excited today to have Dr. Beard, a holistic dentist and sleep medicine provider here in Lubbock, Texas. Not only is she that, but she's also naturopathic certified as well. So really excited. So Dr. Beard, welcome to the Living Life Well show.
Thank you. Happy to be here.
Yeah. So tell us how, you came about all these other credentials besides just going to dental school, becoming a dentist. That just wasn't enough, huh? So I had to go out and get some more credentials.
Yeah, I think that I'm sure just like your practice in medicine, it's always evolving and you learn things that you can't unlearn and unsee. And so you have to sort of know more about it. So I think that when I had been practicing for probably 3 or 4 years, I was noticing some patterns and some patients that I was uncomfortable with. People were breaking teeth and they shouldn't have been, or losing teeth or getting sick and things. And so I just wanted to have a bigger impact on my patients. So when I sort of twisted off and went down the holistic, and I really like the word functional dentistry a little bit better because I think that as my dental practice is evolving, that's sort of what that makes a little bit more sense to me, is that it's a functional ways so that your mouth and your teeth and your oral health can support the rest of your body, that way. But anyhow, I just knew that there was something else that I could do to help in having a bigger impact on your whole body, and incorporating your whole body into what we do in your mouth is really important to us too.
Yeah. So, a lot of my clients come in and a lot of their issues are gut related.
Mhm.
Many times when I have difficulty resolving the gut issues, we kind of go to the mouth and upper airway, because
Mhm.
a lot of times we have things that are just kind of harbingers in there of chronic inflammation, chronic disease process, reintroduction of bacteria further down into our digestive tract. So talk a little bit about that, if you will, how you approach that from a functional dentistry standpoint, as opposed to maybe a traditional dentist would.
Well, as it turned out, your mouth is actually the first part of your GI tract, right? And so a lot of things that we do or that you do or don't do with your mouth can greatly affect downstream. And so, the probably the most profound thing that we talk to patients about, and it's not really something we do, it's just something we teach, is about breathing through your nose instead of your mouth. And so when you breathe through your mouth, it causes a very acidic environment in your mouth. Plaque sticks worse, you know, dry mouth, everything, the microbiome in your mouth shifts to a more pathologic state. And then again, that doesn't just stay in your mouth. I mean, you swallow everything that's in your mouth. And so it goes downstream as well. But it also creates sort of an inflammatory, it's just like an inflammatory start to your whole world. I mean, that's what you're doing. You wake up and breathe, right? And so if we can get people breathing through their nose instead of their mouth, that's number one. Depending on what their periodontal, status is, then a lot of times if we get you cleaned up and then we'll repopulate the mouth with beneficial bacteria. So sort of a prebiotic, probiotic situation that again, continues downstream. These are more specific to the oral microbiome. And so how to keep teeth from demineralizing and keep it a little bit more of a basic situation in your mouth, so that goes towards like no cavities, no bad breath, that kind of thing. There's lots of things that can kind of set up with that. So that's probably the biggest effect that we have sort of downstream as far as your guts go.
Yeah, yeah. I mean, in simple things like, really chewing your food, making sure that
Mhm.
you allow that saliva there to really digest and let those good bacteria do what they need to do. And
That's right.
then as you start that digestive process in your mouth, it can help continue the whole way down. So So, one of the other things I see in my practice is a lot of people be worried about exposures to harmful chemicals and things like that. And
Mhm.
specifically, when we were thinking about dentistry, we a lot of times think about our fillings and potential mercury exposure and those things there. So, can you talk a little bit about how you approach that aspect, or either to replace, not to replace? Kind of go through that process there, if you will, a little bit.
Sure. It's my opinion that the amalgam fillings, so they are 50% mercury. The mercury, the liquid part of the mercury is how we get those amalgam fillings into the nooks and crannies of your tooth. And it doesn't tarnish over and stay, and have no exposure. I mean, there's tons of studies that shows that that's not what happens. So amalgam is one of those things that I say it always needs to come out. It's never safe for you to have. You just don't know, right? You don't know unless you've done some big deep dive in your genetics, first of genetic testing and how you clear toxic, heavy metals, then you just don't know. I think that mercury amalgam, it's a metal filling. And so with the differences in temperatures, so you drink of hot coffee and that metal expands. Your tooth does that too, but not to the same coefficient that the metal does. And so it sort of stresses the internal surface of your tooth, which over time breaks teeth, it cracks teeth and breaks teeth. And so a lot of times we see these old fillings that people have had for a long time, and there's just like a shell of cracked enamel all around it. And so it's not just the toxic burden, but also just as a functional deal, it's just hard on us. It's no good.
Right, right, exactly.
Mhm.
So when you are doing that, is it just a matter of getting the filling out, or does it need to be done in a particular way? Is it kind of the same for everybody?
No, it's super important that you minimize the patient's exposure and really our exposure too, right? To the filling. So when we go in and start buzzing it out, not just the water, when you have a filling, right? There's lots of water and tooth dust and all kinds of stuff, that get in your mouth. What we're really trying not to do is get any mercury particulate either swallowed in your mouth or worse yet, inhaled. And so we use a technique called the SMART technique. And so it's the IOMT, the International Academy of Oral Medicine and Toxicology, has put together a pretty good, they've studied it, a bunch and tried to mess it up a whole lot, right? Lots of different steps that we take to decrease the patient's exposure. So we isolate the tooth with a rubber dam. There's an alternate oxygen source. The patient's covered from head to toe with sort of a paper surgical sheet. We've got our respirator masks on and all of our, head to toe, because we don't want to take the mercury home with us either,
Sure. Yeah.
lots of external suction, big time suction. I mean, they try to just keep it away from the patient and from us. And then we've got an amalgam separator, which separates sort of the metal parts of the filling and that in our plumbing. And so then we have to dispose of that in appropriate ways. So
Yeah, yeah. So you're making sure that it doesn't even leach into our water
right.
our water system that we drink. And so
Yeah.
again, just a key that when somebody is searching out for this, because we do have a lot of listeners that are, really throughout Texas and kind of all over.
Mhm.
So what should they look for if they are interested in having their fillings removed and they don't have access to you here in Lubbock? What would you suggest that they look for when they're looking for a dentist to really be able to help them in this way?
I think that probably one of the most helpful websites is the IAOMT website. So it's IAOMT.org.
Okay.
And you can look for a list of providers that are SMART certified. And those people have gone through and taken some tests about how to manage the mercury content in the with the patient and in the air, aerosolized and all of that. Um, yeah, you say something about in your water supply. It's incredible that we can leave these fillings in people's mouths, but I can't throw it away in the trash. I have to have a separator, like the ADA makes us have a separator in our plumbing so that it doesn't go into the public water, but we somehow, that's okay to keep it in our mouths. Like, that's incredible to me, you know?
Yeah. Yeah. It doesn't really compute, does it?
No,
So
no, no, that's why it's the always and never thing for me.
yes, yes, I would agree. I would agree. So, you mentioned first thing when we got on here about, breathing through your nose to kind of really help. And that's kind of where I wanted to move into because you do something that's really interesting. You really are a sleep medicine practitioner, if you will, as well. And so, there's lots of issues around sleep, just around sleep hygiene and those things, but in particular, sleep apnea. It's at such, epidemic levels in all sexes, ages. And so really, can you kind of talk about that and really what you're seeing in our children nowadays that is a concern and what we as parents can do to help with that?
Sure. So the way we breathe, so if you think about the base of your nose is the roof of your mouth. And so the way your jaws form determines how you breathe. And not totally, but it has a huge impact on the way you breathe. And so if you have smaller developed jaws, and so particularly your upper jaw, if it is a smaller developed jaw, and there's lots of reasons for that, then you probably have a deviated septum because your palate and base of nose was not able to spread out. So then you have a difficulty breathing through your nose. And if your upper jaw is small, your lower jaw, just sort of growth development ways, your lower jaw follows your upper jaw. And so if your upper jaw is small, your lower jaw is small. And you still have the same size of tongue in your mouth. And so that's got to go somewhere, right? And so if your jaws are small, it's particularly lower jaw, then your tongue is going to drop down and back into your throat. And then obviously that's your airway as well. And so that just kind of sets up this whole storm of a really difficult time breathing, particularly at night. And you ask about kids. Well, kids have tiny faces anyway, right? They've got tiny faces. They've got huge tonsils, usually just sort of developmentally. And so they've got a lot of stuff to get around in order to breathe well. And so jaw development starts, when babies are nursing. That's the best thing that you can do to ensure that the baby can breathe through his nose while they're nursing. But it also, the muscles that are used in nursing help develop the rest of the face and mostly the upper and lower jaw. And so it starts then, right?
Yeah.
And then if you've got these little food pouches, right? And they're great. They're organic fruit and vegetables, and maybe, they mix it up and make it a little bit more palatable for kiddos to eat. They mix some pears in it or whatever to make it more sweet. Well, if they are sucking on these pouches and not chewing, their muscles are not doing the things that they need to do. The tongue isn't swallowing and pushing teeth out the way it needs to be doing. And so the jaws are not developing in the appropriate way. And so if you look anthropologically, hundreds and hundreds of years ago, when we didn't have mushy food for our kids to eat, kids, and then obviously adults, had these wide jaws that they had space for all their teeth, including their wisdom teeth. And it's because they had to chew food. And so, you have to kind of worry about that. And so if the kiddos have been on a mush diet, because we're afraid of them choking and stuff like that. I mean, I've got kids too. I did the same thing, but they need to chew. They need to chew hard things. They need to chew on stuff. They need those muscles working in the right way and breathing through their nose while they do that. And so that development, fast forward, and you've got a kiddo in first grade who's got big tonsils because they've been breathing through their mouth and they've not developed their jaws, and they maybe don't sleep great. They thrash during sleeping. Maybe they sleep with their mouth open and snore. Those are all huge red flags for some airway disturbances there, and probably that they're not getting the right types of sleep. And so in the young, like super young, before school age, and then throughout school age, you're hitting these really important development benchmarks. And a lot of times, if these kiddos are not getting into that deep level of sleep that they really need to get a ton of when they're little, they're missing these benchmarks because their body's not able to do the growth and development that happens during the deep sleep. And
Right.
so,
Right.
it just kind of cascades along. So if they catch it young, a lot of times we can maybe not reverse, but sort of stops the negative progress and get them going into a different direction. And if not, then we get people that are our age that, that maybe still have a tongue tie or, still mouth breathe, can't breathe. When we lay down, we can't breathe through our nose anymore, that kind of thing. And then we come up with all sorts of metabolic problems now.
Being a guy who, as a kid, really did have a lot of trouble sleeping, snoring
Yeah.
as a little kid. I had my tonsils and adenoids out at age 7 because of just chronic issues with infection, but also just I can remember as a little kid just waking up quite often in the night.
Mhm.
After that, yeah, it got better. So short of doing that, what can parents look for? What can they
Mhm.
potentially talk about with their dentist? Say they've got a 6, 7 year old that they're, seeing now that is having maybe snoring, that you are knowing seeing some sleep disturbance. You've done all the things with the sleep hygiene aspect to
Mhm.
try and
Mhm.
help there. And so now you're looking at, okay, well, maybe this is an actual physical problem. What can they do to seek out help there?
So I think dentists have a really special spot in all of this because we look in mouths and that's where a lot of this starts. So if a kid is having a problem, they've got the allergy centers, they've got maybe some ADHD stuff, like just behavioral, not sleeping great, that kind of thing. We look at tonsils and adenoids, like you said. If the jaws are underdeveloped, a lot of times we can do some interventional orthodontics where an orthodontist can do some palate expansion and sort of augment and maybe sort of direct the growth that that kiddo has. And so, for instance, my daughter, when she was 8, we had her adenoids taken out. She had terrible allergy shiners. She was a terrible sleeper, thrasher, never got rested, kind of had some ADHD problems at school. And we took her to the orthodontist. They did palate expansion, and almost immediately when her palate started popping open, I mean, she could breathe through her nose better. Her allergy shiners, it took about 2 weeks for them to go away. I mean, it was remarkable. And so that was really before I knew to know about these things, and but it was just sort of, holy cow, that's a big deal. So we can do some interventional orthodontics. We can send them to the ENT. I mean, we look down their throats just like physicians do and see if they, think parents can take videos of sleeping children and if they're snoring or thrashing or doing something kind of choky, that kind of thing. It's really powerful for us to see that in a video. There's some oral functional therapy that can be done, if they've got a tied tongue therapist, which is basically a physical therapist for your face and your mouth and your throat. So they do a lot of posture exercises and strengthening muscles that are probably haven't been used because they, probably not chewing great when they were a kiddo, that kind of thing. And so there's lots of different directions we can send patients. It's good to know. It's good for that's why I think dentistry it's such a great place to start because we look at all those things anyway, you know, and then we can kind of help direct parents to who we think is most appropriate there.
Yeah, as an ER doc and in my training, we only deal with catastrophic issues.
Sure. Yeah.
With dentistry, somebody gets a tooth knocked out or chipped or something like that, and it's midnight and there's no dentist around, so they come into us, but primarily for pain relief, or they've got an abscess, something like that. But what you're talking about, physicians are not trained in. Physicians just really don't look at the mouth from the same perspective that a dentist does. And so to me, that's why it's so important that children really start early, even with baby teeth and
Mhm.
those things, getting in regularly and being evaluated by the dentist, because things like this can be picked up on by the expert, and
Mhm.
then hopefully prevent some downstream effects. You mentioned, going to the orthodontist early. All three of my kids
Mhm.
had the expanders upper and lower and those things. And it really did. It made dramatic improvement with all three of them. So,
Mhm.
so I think that's really interesting, an approach that we don't see in a physician's office, a doctor's office, as opposed to a dentist's office. So that's a really, really neat perspective and a way to really help confer health for your whole life, because if the sleep's wrong and the sleep's wrong early, it just compounds as we get old. Well, that's just part one with Dr. Beard. Tune in next time when we will discuss all the actions that can really help you overcome sleep apnea, how to get diagnosed, how to get treated, and what really seems to work the best, and how it is different in men and women. So I look forward to speaking with you next time. Thanks, and God bless. That's it for this episode of the Living Life Well show. If you like what you've heard and want to learn more, or want to know how to put this into practice for yourself, go to livelifewellclinic.com. Until next time, this is Dr. Jon Skelton saying go out and live the truth so you can live life well.